Hello, and welcome to another episode on Spotlight on Wawarsing. I'm your host, Lauren. Today is May 5th, 2017, and today I'm joined by many guests, as you see, who will introduce themselves.
Hi, my name is Erin Brunette. I am the program director at Step 1.
Hi, I'm Eleanor Minsky, and I'm the outreach coordinator for the Office for the Aging.
Hello, I'm Kameko Green, and I'm a program director at the Institute for Family Health.
Hi, I'm April Cattell, and I'm an outreach worker and care navigator at the Institute for Family Health.
What I would first like to start off with is, can you guys tell me about the agencies you work for?
Sure. So I work for the Step 1 clinic in Ellenville. We are a New York State OASIS certified outpatient chemical dependency treatment program. We basically counsel people struggling with drug and alcohol addiction. We offer a variety of counseling services, mainly group therapy, individual therapy. When needed, we offer couples therapy and family therapy. We do DWI evaluations. We also offer counseling services to adolescents when needed. We get referrals from all over the place. Some people are mandated legally, some people are self-referrals. It's all different sources. We've been in Ellenville since 2005, and that's the focus, is helping people struggling with alcohol and drug addiction.
Well, the Office for the Aging offers services to people of any age who are disabled and people who are over 60. Our services are free, but we do accept voluntary contributions. And our services are mainly to keep people in their homes and remain independent. And then we have many programs under the umbrella of the Office for the Aging. The one that I am affiliated with is called HICAP, and that's the Health Insurance Information Counseling and Assistance Program. A lot of words, and that's why we shorten it to HICAP. Oh, and before I go any further, I have to tell you my accent is from Boston.
I'm from Long Island.
In case we couldn't tell.
And another program that we also administer is called New York Connects. Then we also administer the Volunteer Services Program. The HICAP program is one that's very important to seniors in the area because it tells them all about Medicare and what Medicare does and how it works. And under Medicare, which is a very complex program, under Medicare, we also talk about the Medicare Savings Program. And that's something that I'd like everybody who is watching this to really understand, because it can be helpful, great importance to people who are financially eligible for it. It's a federal program, and only about 40% of people know about it. What it does is it helps you pay your premiums for your Part D prescription plan under Extra Help, which you automatically are eligible for if you're eligible for the Medicare Savings Program. And that Part B fee that you pay, that we all pay to become part of the Medicare program, that is waived. And for a lot of seniors, that $110 a month that we all pay is the difference between them being able to eat and them having to pay it. So it's very important. So look at these figures that I'm holding up here and see if you're financially eligible. That would be $1,377 if you're a household of one. And if you're married, $1,847 a month. That's your income. We don't count assets at all. Assets being your bank account, your house, your car. We don't count that. If you're eligible for this, then you can get back that $110 a month that you pay out, and then you're eligible for a Part D prescription drug program abatement, which will pay your premium, and you'll have a very small copay for your drugs. Call 845-340-3456 and we'll give you more information. The other programs, and I'll just briefly talk about them, is New York Connects, which is a program where you call this number, 845-334-5307, and there's a person. Her name is Gloria. She answers the phone and she will tell you everything you need to know about getting your loved one connected with the services that are provided in Ulster County for the seniors. One-stop shopping. You don't have to look on the internet and get all confused about where in the world should I call my aged parent, has to go into a nursing home, which one? Gloria will tell you. And then the volunteer program. One of the biggest problems we have here in Ulster County for our seniors is how to get transportation. Am I right? Transportation, big issue. So one of the programs that we've developed is Neighbor to Neighbor. And this is a volunteer program where your neighbor calls in, says they're willing to drive you somewhere, and then you can just get in touch with us for this program, and we will get you a driver, and they will drive you to your medical appointment once a week and shopping once a week. So please, those are our services. Please call us at 845-340-3456 if you need any of these services. And if you want information about Medicare, I'm your person, Eleanor Minsky. Just call that number and you will get an individual appointment with me to talk about your own situation. Thank you.
Thank you.
I hope I wasn't
You're
too
going to have your
long.
own key
Yeah.
I'm sitting with the celebrity over here.
Of course, but thank you. Kameko?
Go ahead, follow that.
Should have gone first.
We should do ours together.
So the Institute for Family Health is a federally qualified health center. We operate 26 sites throughout New York City and the Hudson Valley, and we offer a plethora of healthcare services, medical, dental, behavioral health, as well as community-based programs for families. The services are available to everyone, regardless of their ability to pay. In terms of the Hudson Valley, we have sites in Kingston, Port Ewan, New Paltz, and here in Ellenville. Do you want me to go right into our partnership?
I was just about to ask, so you might as well, of course.
Okay. So the Institute for Family Health, Step 1, and Office for the Aging came together as a partnership. We are funded by OMH, Office of Mental Health, and we were 6 partnerships awarded a grant to really focus on access and provision to mental health services, substance abuse services, and aging services to individuals 55 and up. We're really focused on outreach and engaging older adults through care navigation, which is something April does, and I'll let her talk a little bit about that.
All right. I'm April Cattell. I do outreach and care navigation at the Institute for Family Health for our partnership. One of the things that I found through this outreach is that a lot of the patients that need our help the most are ones that are isolating themselves the most. It can be difficult to reach those people. So what I try to do is go out and engage as many seniors as I can so that they can go further out into their communities and engage their friends and families, people that they know who aren't coming out to the events with the Office for the Aging, who aren't reaching out for help, and maybe they just need that little push from that family member or that close friend of theirs. So if you're out there and you know somebody who is 55 and up, we didn't quite get to that part yet, but who's 55 and older and lives in the Ulster County area, and you think that they could use a little bit of help, care navigation, mental health, please reach out to them. We'll give our information at the end to contact us. And then a little bit about what care navigation means. Eleanor over here mentioned New York Connects. It's similar to that. It's having somebody out there in the community who already knows about all the services, who's an expert on what's available, because not everyone can be an expert. You have a lot of things going on in your life. Some people don't have access to the internet, and having somebody who knows about all the things that are out there and can contact you and say, all right, let's go through all your problems. What is it that we can help you find? And then getting you the right numbers, getting you the right applications. That's what we're trying to be there for you. And I can go out into the home and meet people who maybe have those transportation issues. That's a big thing. They can't come to us, I'll come to you.
So why? Why is this such a big deal for us? Why did we really want to address this? So in 2010, 21% of the population in Ulster County were individuals 60 and older. In Wawarsing, that's 19%. Broadening that, we're 12 and a half years away from a 50% increase of older adults in New York State. That's huge. And there's millions of seniors who qualify for assistance and benefits, like Eleanor was talking about, but they don't know about them. So there's 41% of older adults age 60 and older who are eligible for SNAP benefits. The rest aren't enrolled, they don't know. So we have this partnership that really focuses on these issues and gets us out in the community to really find those folks who don't have the information, who don't know. And as April said, I can also go out to them. So it really just lends a helping hand to those people who either aren't able to get out or who don't know about services in the community.
What I would like to ask is, which is you guys kind of answered it for me, why seniors? Meaning, like, why do programs that involve senior care?
I can take a little bit of that. I think that people often overlook seniors as being an at-risk population for mental health and substance abuse. People like to think that substance abuse is a teen issue or a younger adult issue. It's not. If you think about how many medications seniors are on, I believe, I could have the stats a little wrong, but I believe that by the time you're 65, you're on the average is 6 medications. And it can go higher than that depending on what a person's situation is. There's a lot of pain medication that's being prescribed with people who have been having chronic pain their entire lives. So substance abuse continues to be an issue for people in the older adult category. Also, there's generational differences, and a lot of people don't feel comfortable accessing mental health the way that people in my generation do. There's less stigma nowadays, I feel, but there's a lot of people who grew up in a time period where there was a lot of stigma. And so contacting those older adults and trying to bring them into the healthcare system and the mental health care system and the substance abuse care is essential.
And oftentimes people attribute some of the symptoms of depression to physical ailments, you know, especially with older adults. So you might be feeling tired, you might be feeling down, and think this is just a part of aging. And that's not always the case. You know, you may be depressed, and you can change that, and you can do something about that, and we can help you with that.
One of the programs that we have that specifically addresses what you were talking about is our mall walk. Every Tuesday, people gather together at the mall, and ostensibly it's for exercise, but it's really a social event where they're socialized, they get out of the house, and they're able to walk around with their peers, and you know, they don't race around the way our teenagers do. They walk at a good pace, and they are able to get out. And the other thing is that our seniors tend to be a lot more vulnerable than the other populations, and they're also hidden.
Yep.
A lot of them can be hidden in the homes, and they never get out. And so one of the programs that's another volunteer program is one where we have volunteers who are seniors themselves, and they call the seniors on the phone. These are to the shut-ins that can't get out to these programs. So at least they have somebody talking to them on the phone once a day for as long as they would like. And this is very important because that vulnerability shows up in terms of the predators that prey on the seniors. Call them up, and just because the senior is lonely, we'll talk to them and then end up buying services they don't need, all the way up to getting second mortgages. So that's one way that we try to help the seniors. And then, of course, getting out to their lunches at the senior programs. They love that.
Just to add to what everyone already said, representing Step 1, and I mentioned it's a drug treatment program, it's very rare that we have a client over the age of 60 enroll in our program, and the times that they do, I find a lot of times there's a lot of denial in regards to their misuse/abuse of medications. I think what everyone said is on point, that, you know, the elderly population in general, there is such a high potential for misuse and abuse of medication. You mentioned they take medications for depression, anxiety, sleep issues, chronic pain issues, acute pain issues, and a lot of them do not realize how dangerous it is. And I'm speaking generally. I think the percentage of people ages 65 and up that are being prescribed narcotics, I think, is like 40%, or 40% of the narcotics are prescribed to the elderly, excuse me. And that's a big percentage. And, I think we were all at that Ellenville Senior Health Fair a couple of weeks ago that the Wawarsing Council hosted, and we spoke a little bit about that, I even asked the elderly that were there, how many of you are on medications, and a lot of them raised their hands, and a lot of them were shaking their heads when we were talking about how easy it is. Before you know it, you are prescribed 6 or 7 different medications, and a lot of times you're going to different doctors. The doctors aren't communicating with each other. You're getting different prescriptions from different prescribing doctors. You don't necessarily know how they're all affecting each other, and if nothing else, people need to have the education and understand the dangers involved with being prescribed all these different medications. So education is really key, and I think this whole effort is really, really important because it's an epidemic. I mean, again, representing the substance abuse end of it, it really is an epidemic in the elderly population, and it does go unnoticed. I definitely think the focus, I know all the community events I go to, when we talk about the opiate epidemic, it's always focused on younger people, which is absolutely a valid, it's a huge issue. There are a lot of people in their older, that are older in age that are struggling with the same issues, but it's just going unnoticed. So it's definitely important that we're having this conversation about it and joining forces. So.
Well, since you brought that up, I was going to ask, what are some ways to decrease opiate addiction?
I think a big one is people, being more organized with the medications they're taking. I know it sounds pretty simple, but I know those medication boxes where you sort all your medications out, and being aware of what medications you're on, and when you go to a doctor's appointment, because a lot of times you're going to different specialists, you're getting referrals, you're going from here to there, keeping a list of what medications you're on, bringing them to every appointment so that each doctor you're working with knows what you're prescribed. I always recommend bringing someone with you to the appointment, maybe a family member, maybe a caseworker, a friend, someone else who can be present for the appointment, because sometimes when you're in the appointment, you may not think to ask certain questions, or you may not retain all the information the doctor's giving you. It's always nice to have a second set of eyes and ears to, take notes, or maybe ask questions that you're not thinking to ask. So it's really, if nothing else, it's mindfulness that, you know, you should really be careful with what you're taking. And you know, one of you mentioned, I think, about the symptoms looking the same. You know, common symptoms of aging, you know, memory loss, falling, you know, isolation, all these different behaviors that can be displayed are very similar behaviors to people who are abusing medications. And so sometimes it's very easy to assume that someone, they're just old, and no disrespect, but you know, it's just this easy assumption that, you know, that's just the issue, that they're sick or they're old or whatever. And maybe that's not it. Maybe there's more going on here. So I do want to just add to that, you know, for family members or for, you know, again, if someone's in a nursing home, for staff, for anyone who cares about an elderly person and may have concerns, you know, really tuning into their attitudes and behaviors in regards to their medications. If you seem to see that they're really preoccupied with their medication, they have little stashes in their pocketbooks, they're maybe acting more angry or withdrawn, sorry. You know, if you see behavioral changes, sometimes it can be connected to, you know, the fact that they're becoming addicted to their medication. And some people get addicted to it even if they're taking it the right way, because it's a physical dependency, but for a lot of people it becomes a psychological dependency. So it's really important to, again, mindfulness, not just dismiss it that, oh, this is just how they are because they're getting older or they have whatever medical issue. It could be a result of them taking abusable medications, which is not just opiates, but it can be benzodiazepines if they're being prescribed Xanax or Valium or Klonopin for sleep difficulties or for anxiety issues. So it's just super important to not make assumptions and to always rule everything out. So
what I would like to ask...
I started rambling, I'm sorry.
No, it's okay. I feel like everyone's contributing to the part. Isn't that what we're here for? To give everybody the information they need, guys? But, what was I going to say? What do you guys plan on doing moving forward with your partnership?
That's a good question.
So, we actually just went recently to a learning community in Albany, where all of the partnerships were brought together, and it was a great opportunity for us to hear about what other people are doing, get some ideas. So I know April got some ideas of different places to go to try and meet more people. We're still planning on being out in the community. You can look for us. We're going to the senior friendship sites like Eleanor mentioned. I went to the Trudy Farber Center the other day and sat down with some of the people having lunch, so we're definitely out there. We have a couple events coming up. June 14th is the Elder Abuse Task Force Conference. So that's something you can find more information out about. Office for the Aging has a really great email newsletter that has a ton of information about events, things you can participate in, volunteer opportunities. So you can look for some information in there. And that really, this conference has a lot of great information. There's a lot of scams going on, like someone mentioned, you know, people calling and getting your money. Ageism, there's a lot of things going on that this conference really educates you about. The Institute has also partnered with Office for the Aging to do several lunch and learns. We've had a bunch that have already taken place. We have another one coming up on June 15th that will focus on improving your mental agility, and one of the doctors at the Institute will be presenting on that. So please call Office for the Aging to RSVP, and we hope to see you there.
I think one of the things that it's so valuable about this partnership is that we're having the ability to pull together medical, mental health, and substance abuse, and then all the amazing services that are in the area. The Office of Aging is like a wealth of knowledge. It's a treasure trove of available services. And then, you know, having a group like us that can bring all those things together for a patient, and make sure that there aren't gaps between what's going on with them medically and what's going on with them in the community. I feel like people don't spend enough time realizing how their social factors can be affecting their mental and medical health. If you have a doctor's appointment and you want to go to it, but you don't have a way to get there, you're going to start missing doctor's appointments. If you're having trouble paying for your medications, then you're going to start ending up in the emergency room with exacerbations of symptoms. Pulling all of these things together is what you really need to have a truly healthy aging process.
Well, I think everyone's contributed very nicely. I think you guys really explain what you do, which I think is actually pretty awesome. Is there anything else you guys would like to add?
I have to add, else my boss will never forgive me. I realized this after I introduced myself, so I just want to say this, that step one, we do have a clinic in Ellenville. I mentioned that, and I know that most people seeing this live in this area, but I do have to also say that we have a step one program in Highland, New York, which is on the other side of Ulster County. Christopher Dennehy is the program director there, and we also have a clinic at the Northeast Center in Lake Katrine. So we provide substance abuse services to people suffering with TBI. Just if any of you watching this have any concerns about yourself or a loved one that there's potentially a substance abuse issue going on, you're always welcome to call Step 1 at any of the sites, depending on where you live. But in Ellenville, we're 845-647-5400. You can ask to speak to me directly if you just wanted to talk about your concerns and see if this is something you'd want to pursue through Step 1. We can offer evaluation just to meet with the person and see if there is an issue going on, if there's anything we can do to help them with that. So I just wanted to make sure I put that out there.
Well, I would like to issue a special invitation. And it's an invitation to anybody out there that is affiliated with any kind of group that might like this partnership to come to you and give a presentation.
Yes.
At a luncheon or whatever event it is, because we would be happy to come. And when I come with a lot of brochures and information. And I will answer whatever question you have, and if I can't answer it, I know the people at the Office for the Aging that can answer it, because we are, as somebody mentioned, a wealth of information there. So please call us. And what we're trying to do is do outreach to this area. This area has been neglected. There's a lot going on in Kingston, but when you think about here, and all of the little towns around here, Ellenville and the surrounding, Wawarsing, what have you, we want to focus and help the people here as well. We have brochures at Family of Ellenville, at the Trudy Farber, where you have your senior lunches. And we can place our brochures anywhere that you would like. And that way we get the information out to this silent population. And the other thing I want to mention is minorities. The Office for the Aging is really trying to outreach to these silent populations, minorities in particular, Hispanics, Asians, African Americans. We want to come to you and give you our services. So please, don't think that this is for certain types of people. No, it's for all of our seniors and all of our disabled people living in Ulster County.
So I think the takeaway message is that older adults can live fulfilling lives, and that's going to mean different things for different people, but we are here as a partnership to offer our services to you to help you along the way, whether it be substances, amazing volunteer opportunities, and other walks in the mall, helping you with transportation or your medical appointments, or talking to you about how you've been feeling lately. We're here and we're available for you, and we'd love to hear from you.
I just want to give everyone my number. My number is 522-1313, call me. I will come to you if you can't come to me. I'll come talk to your community group. I'll come talk at your senior center.
She'll talk.
I'll talk. I like to talk. And I work very closely with these folks, so anything that's going on there, I can be a point person for you if you need it. And then to get back to Eleanor's point, hablo español, entonces si necesita eso, puedo ayudar. And that's all.
Well, thank you guys so much for joining us on this episode of Spotlight on Wawarsing. I'm your host, Lauren, and see you next time.